Good afternoon. We are Group 9 for the Community and Mental Health Nursing course, and today we'll be presenting on the mental health issues of high-risk groups for substance abuse. Our group consists of 4 members, namely Anjali Amor, Froilan Manon-Og, Shui Rong, and myself, Jeanette Park. Each one of us will present a portion of the discussion today. Our presentation objectives are as follows: to define substance abuse in high-risk groups, to demonstrate the effects of substance abuse, to identify high-risk groups for substance abuse, to identify mental health issues associated with substance abuse, to highlight treatment options, and to identify possible nursing interventions for this population. The World Health Organization defines substance abuse as the harmful or hazardous use of psychoactive substances, including alcohol and illicit drugs. Substance abuse can lead to what is called dependence syndrome, which is a cluster of behavioral, cognitive, and physiological phenomena that develop after repeated substance use and that typically include a strong desire to take the drug, difficulties in controlling its use, persisting in its use despite harmful consequences, a higher priority given to drug use than to other activities and obligations, increased tolerance, and sometimes a physical withdrawal state. We've all seen the effects of substance abuse, and these are some of the examples that we found. The following the following statistics regarding substance abuse and mental health disturbances are taken from the Center for Addiction and Mental Health and show us the extent of the problem. For example, every year, 1 in 5 Canadians experience a mental illness or addiction problem. By age 40, 1 in 2 Canadians will have experienced a mental illness or addiction problem in their life. Individuals with mental illness are 2 times as likely to have substance abuse problems. 20% of those with mental illness have concurrent substance abuse problems. In schizophrenia, it can be as high as 50%. Mental illness is the leading cause of disability in Canada. Among Ontarians aged 25 to 34 years, 1 of every 8 deaths is related to opiate use. We can see from these statistics that there is a strong link between mental illness and substance abuse. The effects of substance abuse are both intense and all-encompassing to both the individual and his or her friends and family. The physical effects on the individual are sleep changes, decreased memory and cognitive abilities, abnormal vital signs like respiration, heart rate, and blood pressure, chest or lung pain, nausea, vomiting, diarrhea, stomach pain, as well as changes in the skin. It can be cool and sweating or hot and dry. There's an increased rate of diseases such as hepatitis B or C or HIV from needle sharing, a possible impotence, more frequent illnesses from a decreased immune system, and frequent hangovers and blackouts. Along with the physical effects of substance abuse, there's also significant psychological effects on the individual. We see a preoccupation with getting the drug. The sole focus of the individual is on obtaining the drug, securing the drug. We see also mood changes, including often depression, anxiety, irritability, and aggressiveness. There can be significant selfishness, sometimes hopelessness occurs, and certainly a lack of pleasure from previously enjoyed activities. So things like hobbies or interests that used to grab the individual's attention no longer hold their interest. They can often be people who then pressure others into doing drugs as well, and this alters relationships. Next, we'll take a look at a brief outline of the effects of substance abuse on the lifestyle of the individual. Firstly, there's often a significant loss of relationships of family and friends as the abuser chooses drugs or alcohol over all else, including relationships. There is also a profound effect of the substance on personality, behavior, and character, and this can be alienating. Loved ones are forced to watch as the individual pulls away and is radically altered by the substance in many ways. The substance can also affect performance at work or at school, as the individual again displays strange behavior and personality changes, often making very poor choices. There can be a loss of job or even disciplinary action as a result, and we can follow this downward spiral. Further financial problems can be the consequence. The individual will also likely become decreasingly interested in hobbies or other interests, as mentioned before, again, because their sole focus is on the substance. Here's another area of life where a loss of relationships can be experienced as well. So we can see from all of this that the effects of substance abuse are really profound and touch on every sphere of life. They are truly all-encompassing. I'm going to pass the microphone on to my colleague Shui. She's going to move on to the risk factors of substance abuse. Thank you.
Risk factors for prescription drug abuse. People of any age, sex, or economic status can become addicted to a drug. However, certain factors can affect the likelihood and speed of developing an addiction. Family history of addiction. Drug addiction is more common in some families and likely involves genetic predisposition. If you have a blood relative, such as a parent or sibling, with alcohol or drug problems, you are at greater risk of developing a drug addiction. Being male. Men are more likely to have problems with drugs than women are. However, progression of addictive disorders is known to be faster in females. Having another mental health disorder. If you have a mental health disorder such as depression, attention deficit hyperactivity disorder, ADHD, or post-traumatic stress disorder, you're more likely to become dependent on drugs. Peer pressure. Peer pressure is a strong factor in starting to use and abuse drugs, particularly for young people. Lack of family involvement. Difficult family situations or lack of a bond with your parents or siblings may increase the risk of addiction, as can a lack of parental supervision. Anxiety, depression, and loneliness. Using drugs can become a way of coping with these painful psychological feelings and can make these problems even worse. Taking a highly addictive drug. Some drugs, such as stimulants, cocaine, or painkillers, may result in faster development of addiction than other drugs. However, taking drugs considered less addicting, so-called light drugs, can start you on a pathway of drug abuse and addiction. Next presenter is Anjali. Thank you.
Hi, I'm Anjali and I'm going to discuss about the mental health issues associated with substance abuse. Having a substance abuse problem and a mental issue such as depression, bipolar disorder, or anxiety is called a co-occurring disorder or dual diagnosis. Having a dual diagnosis can make recovery more challenging. Depression. Many of the factors that contribute to depression also play a part in substance use disorder. Imbalances in brain chemistry, family history, and past trauma, for instance, are frequently involved in both depression and addiction. In addition, the physical and psychological effects of addiction may mask the sign of depression or worsen the symptoms of this psychiatric illness. Alcohol and drug abuse can worsen the course of a depressed disorder by aggravating the symptoms of depression, increasing the likelihood of hospitalization, and interfering with the course of treatment. Individuals who are being treated for depression while using drugs or alcohol are unlikely to see positive outcomes from therapy. Substance abuse impairs motivation and decreases the effectiveness of therapeutic interventions. In addition, alcohol or drugs can have dangerous interactions with the medications used to treat depression. Next is bipolar disorder. One of the reasons for this phenomenon is an individual attempt to self-medicate with drugs and alcohol to numb the painful symptoms of their bipolar disorder. Symptoms of bipolar disorder such as anxiety, pain, depression, and sleeplessness are so alarming that many individuals will turn to drugs and alcohol as a means of offsetting the discomfort, it only for a little while. According to National Institute of Mental Health, drinking alcohol or using drugs may trigger depressed or manic moods in someone with bipolar disorder. Next is anxiety. People initially develop an anxiety disorder, start self-medicating with drugs of abuse, and end up with a dual problem, anxiety and addiction. In some other ways, someone begins using a drug of abuse and then develops an anxiety disorder as a consequence of their addiction. The next topic will be discussed by Freud about the treatment and the nursing priorities. Thank you.
Hello, I am Froiland, and I will be discussing about the substance abuse treatment. So, I got a question. Can drug addiction be treated? Yes, but it's not simple. Because addiction is a chronic disease, people can't simply stop using drugs for a few days and can be cured. Most patients need long-term or repeated care to stop using completely and recover from their lives. So, addiction treatment must help the person do the following, according to National Institute of Drug Abuse. So first is stop using drugs. Second, stay drug free and be productive in this family, at work, and in society. So here are some treatments for substance abuse. Methadone, brand name Dolafin, or Methadose, buprenorphine, Subuxone, Subutex, or Probuphine, and naltrexone, brand name Vivitrol, are used to treat opioid addiction. Nicotine replacement therapies have several forms, including the patch, spray, gums, and lozenges. So these products are available over the counter. The medications are more effective when combined with behavioral treatment such as group and individual therapies, as well as telephone quitlines. So some of the treatment for alcohol or alcohol addiction are the following. So 3 medications have been approved by the FDA for treating alcohol addiction, and a fourth, topiramate, has shown promise in clinical trials. So this is according to large-scale studies with people. The 3 approved medications are as follows: naltrexone, acamprosate, and disulfiram. So first, naltrexone reduces relapse to heavy drinking and is highly effective in some patients. Acamprosate, brand name Campral, may reduce symptoms of long-lasting withdrawal, such as insomnia, anxiety, restlessness, and dysphoria, which are generally feeling unwell or unhappy. It may be more effective in patients with severe addiction. Disulfiram, brand name Antabuse, interferes with the breakdown of alcohol. Compliance can be a problem, so taking the drug as prescribed can be a problem, but it may help patients who are highly motivated to quit drinking. So other treatment are co-occurring conditions. Other medications are available to treat possible mental health conditions such as depression or anxiety that may be contributing to the person's addiction. There are plenty of different treatment medications that can be given to help substance abusers to stop their addiction. It all rely on how the health professionals will address and target each symptoms that the patient is manifesting. Now, nursing priorities. So these are the nursing priorities that nurses should be providing during their care to the patient. So provide support for decision to stop substance abuse, strengthen individual coping skills, facilitate learning of new ways to reduce anxiety, promote family involvement in rehabilitation program, facilitate family growth and development, provide information about condition, prognosis, and treatment needs. Okay, for the conclusion. Change usually starts from oneself. Without the eagerness of one client to change, treatment plan and interventions will be futile. It is essential that nurses and healthcare professionals provide adequate care or planning to address issues along the course of treatment. It should be kept in mind that, regardless of the situation, we are ought to provide dignified and holistic care to our clients. However, boundaries and limitations are to be set when it is deemed unsafe to practice with a client. Thank you very much for listening to our presentation. So if you have any questions, reactions, or clarifications, feel free to send us an email or a message. Thank you. And then here are some of our references that we use in our discussion.